I'm here with Dr. Margaret Wehrenberg, clinical psychologist, international presenter, and author of many books, including the 10 Best Ever Anxiety Management Techniques, the 10 Best Ever Depression Management Techniques, and many others. Thank you, Dr. Wehrenberg, for taking the time to answer a few questions this morning.
Oh, I'm happy to, and thank you, Jack, for inviting me.
Great. Now, Dr. Wehrenberg, you will be providing two full-day workshops in Calgary at our Canadian Mental Health Summit conference. And I have one question to open our discussion. Two of the most common mental health problems are anxiety and depression. In your view, what factors are causing the rise of these two conditions, not only with adults, but with the younger population as well, with children and adolescents?
Well, this is obviously a question that so many researchers and clinicians are asking. But as I look at the research coming out, one of the significant causes of the rise is stress related, actually, but not like, oh, we're so busy stress. It has more to do with the stress of the modern world and our need to learn how to handle it and the way that stress changes our body, literally, physically. So if you think about adult stress, financial stress, issues related to uh, climate change, issues related to the politics around that, issues related to our financial well-being, all of those things are adult related stressors. Then you look at parenting related stressors in a middle range of adults, which is no light burden to carry. And then children and adolescents in college age, the impact of social media, video gaming, and sort of 24/7 internet access. These are stresses that affect every age group, but dominantly hard for the junior high school, and early college age person. And learning to manage those stresses is important, but the impact of constant stress is this sort of inflammation in our system that affects our brains, it affects our body, and one of the outcomes is the creation of anxiety and depression. So it's a multitude of factors, but responding to the pressure of modern living is something that all of us need to be paying careful attention to.
Great, yeah. Anxiety and depression is certainly on the rise. I'm also aware that roughly 50% of individuals who suffer from anxiety also suffer from depression and vice versa. Can you shed some insight into why these two disorders commonly coexist?
There are a couple of important factors, one of which is neurobiology. There are some structures of the brain that are related to the perception of negativity in your personal world and also related to repetitive ruminative thinking. And those structures interacting with each other cause a lot of the anxiety symptomatology of worrying and fretting and being kind of on this, as one of my young clients calls it, her hamster wheel of worry. And the other issue with the depression is that while there is ruminative thinking also generated from these same two structures of the brain, when there's depression involved, it tends to be more connected to rumination over I'm helpless, it's hopeless, there is no help for me. And so it's these structures that perceive more negativity than exists in actual fact, the tendency to see negative events as much worse than they actually are, and then the repetitive thinking. All of these are generated from the structures of the brain that are not so much the thinking brain as they are the emotional brain. And when these structures are undersupplied with neurotransmitters that help them work smoothly, we start to see the symptomatology emerge. And for me, interestingly, because of my specific interests, anxiety often precedes depression.
Mm,
So in the history of life, if you've got an anxious child, adolescent, young adult, it's really important to intervene on anxiety, not to regard it as Oh, they'll get over it because it can lead then to developing the depression afterwards as a real significant mental health disorder.
Oh, great. Okay. On day two at the conference, you'll be addressing the topic solely on depression,
Right.
and will shed light on the four different types of depression. Can you briefly explain? I know you have a full day in Calgary, but briefly explain the four types of depression and why it's important for practitioners to know that these differences exist?
Yes, and I will tell you that these four types of depression are sort of my explanation of how depression emerges out of different situations or at different times of life, and that treating depression that emerges in these times becomes very, very important to sort of spot the difference. So, for example, the first type that I'll talk about is endogenous depression, which by which I mean I call it the brain you're born with. This is a person who has a setup in their neurobiology to become depressed. You can maybe see that through family history, a lot of problems with depression in family. Um, and that is a person who's going to struggle somewhat differently because the prospect of recovery is for a person who hasn't really had lots of experiences in life that weren't sort of, if you will, colored by depression. Very often, this person tells you that they're aware that they've probably been depressed all their life. The second kind is the kind that emerges from situational stress. And I was just sort of referring to the terrible impact of stress that occurs over time. But the bigger the stressor, the less ability you have to influence outcomes, the more likely that is to result in a depressed state of mind. It changes your neurobiology, but it also changes your mental attitude towards life and your ability to take charge or make changes. So situational stressors, big cause of depressions. Another cause is experience of trauma and the outcome of trauma, and really at any age, that trauma changes the brain. And depending on, let's say, the significance of the trauma for creating physical, psychological pain and changes in your life, the more likely depression is to be one of the symptoms of trauma. And knowing that means we have to understand the original of trauma the origination of trauma and a little bit about how to intervene on depression as part of trauma treatment. I won't be discussing the whole of trauma treatment, obviously, but taking a look at depression. And then the fourth kind is the kind of depression that emerges from early childhood adversity. And that could be adversity due to living in poverty, living in oppression, living in families where there's tremendous dysfunction.
Right.
And it can be not necessarily physical or sexual abuse, but just the burden of adversity in the family. So I will be looking at how that affects the treatment of depression, because in those cases, there's a different mental attitude towards self-control and self-efficacy. So those, in a nutshell, I guess, are the four types of depression. All of those are supported by research, but they're kind of my delineation of the way depression emerges, that as I have seen it over 40 years of doing therapy with clients.
Wow. So it sounds like we'll have to set another day on trauma and how
Well, yeah,
it
because
impacts or leads to depression, anxiety.
as you're talking with others of the clinicians who are presenting for you, I know that trauma pops up all over the place when we're looking at mental health as an issue we have to be aware of. Even those of us who aren't specializing in trauma treatment have to recognize its impact, I think.
Yeah, and that's good. At the conference, Dr. Ebony Webb will be talking about trauma. So, uh,
Great.
yeah. So another question, anxiety and depression often share the same symptoms, whether it's fatigue or sleep disturbances or problems concentrating. How does a therapist know where to get started in treatment with their clients?
Yeah. Well, first of all, I kind of wrote a book that addresses this. It's called Anxiety Plus Depression, and the kind of different presentations of anxiety and depression. So when you have a really lethargic kind of mentally and physically lethargic, depressed client who's also got a lot of worrying and fretting, you can't go charging in with energetic therapy approaches that require, let's do it consistently. Likewise, when you have a very high drive, totally worried person who's you think is kind of trying to outrun their depression by keeping a very busy lifestyle, that intervention looks a little different too. What I think is important for therapists to understand is what is the mental energy of the client they're dealing with. Very often people with high anxiety also have kind of high mental energy, and you can be a little more directive and a little more um, um, insistent on following certain cognitive or behavioral patterns. Like a high energy, anxious person is more likely to cooperate with creating a program for being more, doing more exercise, for example. Or they might be more willing to pursue changes in their nutrition. Whereas a highly depressed person, as much as they need to do those things, they may very well not. With every anxiety and depression that has physical symptomatology like sleep troubles, energy troubles, you always want to make sure you get some physical exam as part of their treatment. But what I really want to suggest is looking at the not just the motivation to get better, but the emotional, cognitive resources that that person brings to the treatment. And sometimes it's a matter of what other resources they also have. Are they connected in their community and in their family? And how are those connections going to support their recovery, or sometimes a drag on recovery? If there's an interference in an intimate relationship or family relationship. So I want to kind of explore, just to backtrack a step and be clear, you're always looking for your client's capacity to use the techniques you're offering them. And in these seminars, I'm going to offer lots of techniques, so there'll be a lot of opportunity to choose from among the things that you think are going to be appropriate for where your client's mental and physical energy is.
Okay, excellent. Just one final question, because I know you're squeezing this interview between sessions, and I really appreciate that.
Yeah.
My youngest daughter, Stephanie, has just started her master's in counseling at UBC, and she came to my office, and I gave her what I thought was a number of valuable resources, and I did pass on one of your workbooks on anxiety.
Yeah.
I just have them right here.
How nice.
They're the 10 best ever anxiety management techniques workbook. So I thought that would help. What advice can you give a therapist who is new to the field when treating clients with anxiety and depression, suffering from anxiety and depression? Any tips or interventions that you would recommend to a new therapist?
I think that if a new therapist is armed with some very pragmatic techniques so that they feel like they've got something to offer to their clients, they're going to feel more confident, and the clients are also going to feel more trusting. I ran across some interesting research about the way the world of therapy is changing, especially with some younger clients. And by younger, I mean under the age of, say, 35. And their expectation of therapy is not what it was when I started practicing many, many years ago. Their expectation is give me something fast and help me feel better right away. And then they'll maybe stick with you to look at things like underlying dynamics. How did I get here in the first place? So I think a new therapist would be well advised to know how to help a client become calmer. Breathing techniques, very helpful. Mindfulness awareness techniques. Even if you don't practice mindfulness or mindfulness-based stress reduction, you can learn something from mindfulness about how to be in the moment, instead of having your mind fly to negative outcomes or going barreling down the road to how things will go badly. If you stay in the moment and practicing that with your client. Another set of techniques I think are really helpful are techniques to interrupt repetitive worrying, because that goes with depression and also with anxiety. And the other thing is learn the importance of small steps.
Okay.
Don't make big leaps with your clients not because you don't know that they're going to make eventually big leaps, but
Right.
because clients with depression feel overwhelmed by the process of recovery. So always think about small steps that your client agrees with you. They have the energy to try something new. Those would be some just beginning points I would offer. And there are many books that sum these techniques up. I've
Okay.
obviously written books that are very pragmatic, the 10 best ever anxiety management techniques and the 10 best ever depression management techniques,
Mhm.
which, by the way, are not the same book with two different covers. Very different techniques in both books. Um, I think if you read some of the basic books about mindfulness based stress reduction, that would be another big help for many people. But obviously, techniques along that nature are really going to help the beginning therapist while they start to get their feet wet on the other aspects of treatment.
Great. Well, thank you, Margaret, for taking the time to share your wonderful ideas. And I look forward to working with you at the conference in Calgary.
Well, I look forward to seeing you again very soon, Jack, and I'm looking forward to an excellent conference. You've got a great lineup, and I'm happy to be part of it. Thank you.
Okay, great. The Canadian Mental Health Summit Conference will be held in Calgary November 20th, 21, and 22. You won't be disappointed, and I look forward to seeing you in Calgary. And I look forward to working with you and seeing you, Margaret. Take
Oh,
care.
you too, Jack. Bye.
Okay.